Hello.
Hello, hello.
Hi, how's it going?
Good, how are you?
Good, good. Want to come in?
Of course.
Oh, look, we have a
my
special
goodness.
surprise
We have
guest.
A special surprise. Hi.
Paxton. Hi. Okay.
Okay.
Come on, put it back in. How's it going? Sorry it's so
Good.
rainy.
Oh, it's okay. I didn't have to swim here, so that's
Oh,
okay.
good, good.
So, are you ready for your 73 questions?
I am. It's a little echoey. Do you want to come this way?
Sure.
Yeah. Come on, Pax. Let's go.
Alright, we gotta have the guest star.
Come on, Paxton. Pax, come here. Good
He'll come along
boy.
with us.
He'll come along.
Alright, so let's get started.
Yeah.
What's your name?
I'm Yang.
And what is your specialty?
I'm a vascular surgery resident.
And what year are you in training?
I'm in my 5th and final year.
Almost done.
Yes, almost done. Very excited.
Alright, are you ready to be done?
I am ready. Some days I feel like I could use a couple more months, and other days I'm like, yeah, I could graduate right now.
Yeah, I think that's the confidence needed
Yes.
in surgery. So, where did you go to undergrad?
I went to undergrad in Drew University in New Jersey.
And medical school?
Medical school was Drexel in Philadelphia.
Woohoo! My dad graduated from Drexel.
That's right, go Eagles.
So, did you take any gap years before going into medical school?
I did actually. So right after I graduated college, I worked as a scribe in an emergency department. And I did that for 2 years, and then I went to medical school afterwards.
Right. So, do you remember what your favorite part of medical school was?
Ooh, my favorite part, probably the feeling I had right after I took step 1 and the feeling of just generalized freedom. And of course, all of my really good friends that I met from there.
I know that sense of freedom all too
Yeah,
well.
seriously.
So, what specialty did you think you were going to go into on your first day of medical school?
I thought that I was going to go into emergency medicine just because of all my time as a scribe in the ED. I really looked up to them, so I really thought that was going to be it for me.
So, what changed your mind about that specialty?
I think it was a little bit too chaotic for me. I realized afterwards, after actually kind of doing everything and seeing everything that went on, that it wasn't really right for my personality.
You wanted to avoid chaos, so you went into surgery?
Correct. There's a sense of control in the operating room that I really enjoy.
Controlled chaos. I can agree
That's
with
right,
you there.
that's right. Especially in vascular surgery, you know?
So, were there any specialties you immediately said, absolutely not for me?
Yeah, neurology really wasn't it for me. I thought that that was very challenging. And then pediatrics, also not really for me.
Okay. So, what first made you fall in love with vascular surgery?
I was very fortunate that on my general surgery rotation, my chief resident at the time, who was going into vascular, had me scrub a lot of cases. And actually, my first case ever was a carotid endarterectomy, which I don't know if people have seen, but has some of the best anatomy in general. And so that really, really sucked me in.
So, I'm sure there's a lot of people watching who want to be a vascular surgeon. So, how long does your training take after med school?
So after med school, there's two general routes that you can take for vascular surgery. I'm in an integrated program, so we call that 0+5, meaning 0 years of general surgery, 5 years of vascular. And then alternatively, there's the 5+2, which is 5 years of general surgery and 2 years of vascular surgery fellowship.
Okay. So, are there any subspecialties that take just as long for post-med school training?
Yeah, I think some of the other ones that take 5 years are like ENT. I think ophtho is 4 years, plastics is 6, urology is like 5 or 6, and then neurosurgery is about 7.
Yeah, neurosurgery.
Very long, yeah.
Do you consider any other degrees like an MBA or an MPH at all?
I have not.
Okay. So, what would you say is the most unique part of your specialty?
I think the most unique part of my specialty is just how much endovascular and open surgery we're able to do. So we kind of have a very generalized hybrid approach to everything. So we're able to do things both open and endo in the same case and convert to either which one during the case, which I think is very, very unique.
So why should someone choose your specialty? This is where you get to sell it.
I think you should choose vascular surgery if you're really into innovation. That's one of the big ones. Our endovascular things, the field is kind of advancing and growing every day, and there's a lot of new devices that come out on the market constantly. Vascular surgery is also great for people who want kind of a long-term relationship with their patients. I think this is very unique in surgery in general, because once you meet with the patient, you kind of have helped them through everything. There's a surveillance protocol usually for a lot of the things that we do, so we say that we're married to our patients for life.
So, flip it around, play devil's advocate. Why should someone not choose vascular surgery?
Cases run really long. That would be very challenging as well. And I think, if you don't like endovascular work with wires and catheters, I think that it's probably not for you.
Okay. So, fun question. Are there any stereotypes of your specialty?
Yeah. I think the stereotype, which I'm hoping is gone now, is that vascular surgeons are mean and angry all the time because we take a lot of call and our lifestyle can be challenging or a little bit harder in terms of the amount of operations we do, late night cases. I think that's probably one of the more negative ones, but you know, kind of a new wave now and things are changing.
Are the stereotypes true?
I don't think so. I find myself pretty nice. I don't think I'm that angry when people call me for consults. And as a whole, my attendings are all awesome. My residents are all awesome. You know, everyone's very happy and we all love what we do.
Gotcha. Yeah, you don't seem angry and bitter.
No. But you know, it's a Saturday, we're hanging out. It's a good day.
That is true. Just caught you on a good day.
Yes.
So, obviously you're training at an academic institution.
Yes.
And I'm sure you get to interact with a lot of medical students and even people shadowing.
Yeah.
So, what is your go-to question to ask your med students or anyone training with you?
I'm generally not a pimp-heavy type of person, so I generally just like to ask medical students, you know, what they want to get out of the rotation and what they're hoping to learn. If I do feel a little bit more feisty in the OR, sometimes when we're doing a carotid, I'll ask them for the branches of the external carotid artery. That's about like as much as I do.
You're so nice. So, what is the craziest thing you've ever been pimped on in the OR?
Ooh. One of my attendings really likes to play classical, like 80s music, and he'll ask me which artist is singing this, and I, growing up in an Asian American household, usually have zero idea. And he'll be like, what song is this? I'll be like, I don't know, I grew up with Chinese parents.
Average experience in like rural Georgia. I remember that from my general surgery.
Yeah.
Alright, so kind of getting into the bread and butter of what your day looks like, what does an average day look like for you?
So usually I'll wake up between 5 and 5:30 a.m. I like to chart check at home before I go in and round. As a senior resident, we're responsible for rounding on the service. So usually from like 6 to 7 we'll round, and then we'll run the list with our attendings from 7 to 7:15, 7:20. And then cases start at 7:30 every single day. So our cases generally average anywhere from 2 to 3 hours per case. Then there's turnover time. Obviously there's longer cases that can take 5 to 6 hours, and so we just kind of progress through our day doing cases. And in between cases, I'll try to touch base with the floor team, check in with the console residents, put out any fires, etc., etc.
Gotcha. So how many patients do you see on an average day?
On an average day, patients that I round on, probably anywhere from 10 to 15, and then operatively, probably about 4 to 6.
What's the most amount of patients you've ever seen in a day?
27.
Oh my god, that's a lot. What is the hardest procedure you've done?
Ooh, the hardest procedure I've done was probably a 13-hour case. It was a complex endovascular aortic case, and it was just very, very technically challenging, and that was probably one of my longest days of residency.
This was not a planned question, but how do you go to the bathroom in those 13-hour cases?
So you're just so focused in what's going on and trying to get to the next step that you kind of forget all bodily functions. I think I remember at the 10-hour mark, we were finally at a good spot, and my attending was like, all right, we're all gonna sequentially take breaks and take a drink of water and come back. So we're very good about that, yeah.
So, moving on to the regularly scheduled questions.
Yes.
What is the most common procedure you do?
The most common procedure I do currently is probably an angiogram for peripheral arterial disease.
What is the most memorable case you've done so far?
My most memorable case would probably have to be a couple months ago, where I had a lot of autonomy. It was a iliocaval reconstruction for a patient who had a previous filter and DVTs, and I was given a lot of autonomy during the case, and the attending was very, very happy with the outcome, you know, afterwards, and I was really happy too. So it was kind of a taste of kind of being an attending and, you know, being out on my own and stuff like that.
Should be very soon.
Yeah, I think 39 weeks, something like that.
And who's counting?
Who's counting? James is counting.
What is the toughest part of your job?
The toughest part of my job is when we have to tell patients that, you know, either the procedure was not successful, or we kind of have to reconsider next steps and kind of, you know, not always having the outcome that we were striving for.
On the flip side, what's the most rewarding part of your job?
Most rewarding part of my job, I would have to say, I'm going to answer this in two and cheat a little bit. One of the most rewarding parts is obviously seeing the patients in clinic and having them kind of return to their baseline function or just saying that they're feeling better. And I think another rewarding part is when a medical student tells me that, they've decided on vascular surgery or they're interested in vascular surgery, and I'm like, yes, recruitment.
Hey, comment down below if you're going into vascular surgery.
Yes,
Want to go into vascular surgery.
Hit me up on Instagram, we can talk.
Yeah. Cue the lower third. All right, so now some lifestyle questions.
Yes.
How many hours do you work in an average week?
I would say it depends on which site I'm at. So right now I'm at one of our lighter sites. I would say 60 hours. Heavy sites, 80 hours. Sometimes over 80, but don't tell my program manager.
What time do you normally wake up?
I wake up between 5 and 5:30.
What time do you normally leave the hospital?
Depends. On my light rotations, I leave between 4 and 5. On my busier rotations, 8 to 9.
Okay. How many hours of sleep are you typically working on?
I try to average 6 hours of sleep a night, so that's usually the goal.
How much sleep are you working on right now?
Right now, let's see, last night I went to bed at 10 and I got up at 6, so pretty good, honestly, for a surgery resident.
Do you have to take call?
Yeah, we take call. So as senior residents, we take Q4 call, so that's for weeknights and weekends.
Okay. Are you a night or day kind of person?
I am a night kind of person.
Okay. How long does it take you to chart at the end of your day?
Well, as senior residents, we don't do a whole lot of charting, so I chart in between cases, which is obviously way better.
That is so nice.
Yeah.
So,
Perks of being in an operative specialty.
That is true. Who are you most thankful for on your care team?
Sorry, can you say that again?
Who are you most thankful for on your care team?
Oh, I'm really thankful for our interns. I think they have the hardest job of all, and they are really responsible for keeping the service together. So I think they do a very underappreciated job.
What is the funniest thing you've heard in the OR?
Oh, there's a lot, but usually it has to do with something about roasting another co-resident of mine. We're very close, all of our residents, so usually it's some crazy story about our intern ordering something very expensive at a dinner or something along those lines.
Oh, I thought you were going to say ordering a very expensive exam or test.
No. That's not funny, that's just that.
I know. Alright, what's the most common medical advice you give to your patients?
Stop smoking.
Amen to that. And with that, we've talked a lot about your life inside the hospital, so how about your life when you clock out? So what is your favorite thing to do when you're not working?
My favorite thing to do when I'm not working is hang out with this guy, Paxton, right here. Right, Paxton? Yeah.
I caught the glance of him going, yes, okay, Mom.
He's like, can we go now?
So, do you have a significant other?
Yes, I'm married.
Alright, and does your family ever ask you for random medical advice?
Yes, they do. My brother will text me random questions about things that are not related to vascular surgery at all, and my mom likes to occasionally text me about random things as well. Sometimes my dad still thinks that I'm a cardiac surgeon, so we're working on that.
When you go to med school, you sign up to be in the on-call resident for life.
That's
for your
so
family.
true.
So, what is the weirdest question a family friend or friend has ever asked you?
Someone asked me about a rash recently, and I was like, I'm not a derm resident. I don't look at rashes at work, so I'm sorry. I don't really know what to make of this very blurry photo.
Always the derm.
Yeah,
stuff.
always the derm stuff.
Right. So, well, I was gonna ask any pets, but I think we have the answer to that here.
Yes, that's Paxton. He's our little baby. Right,
He's
Paxton?
doing so good.
Yeah, he's very well behaved today.
Goodness. So, favorite animal, not a dog or cat?
I have to say a guinea pig because we had 2 guinea pigs during medical school, so they've passed. But they were great pets and they actually were with Paxton for the first 2 years of residency. Yeah.
So, if you could have dinner with anyone in history, who would it be?
Anyone in history? Wow, that's a big one. This is a little harder, but I think probably I know anyone in history, but what comes to mind is my grandfather. He was in China and he was a physician as well. And so I never really had the chance to kind of talk to him about his career as a doctor. And he's the only member in my family who had that experience.
Gotcha. What would you two be eating at the dinner?
Oh, definitely some homemade Chinese food. I think, I don't even know how to say some of these things in English, but kind of like some of the oxtail things and some of the more like traditional Chinese dishes.
Okay. What's your favorite dish to eat?
My favorite dish to eat right now is probably Korean barbecue. I know that's like a generalized statement, but I really, really, really love some galbi.
Now I'm hungry. Coffee, tea, or soda?
Coffee.
How much water should you be drinking every day?
How much should I be drinking? Probably a liter.
A liter, very specific amount. Favorite meal from the hospital cafeteria if you have one?
Actually, I do. It's at lunchtime they make chicken teriyaki rice bowls, and those are actually really, really good, and they're always warm. So it's always great to grab between cases when I'm freezing.
That is an incentive that I didn't expect to have at your program. Well, time to put that higher up on the list. Pineapple on pizza, yes or no?
No.
Good. Any artistic hobbies you keep up with?
Yeah, I am into photography and social media and creating reels. My husband and I, James, were really into kind of taking photos and post video and post photo production. So those are always fun. For a period of time, I was into calligraphy, but that's kind of fallen off.
So, what's your favorite song to listen to in the OR?
Recently, we went to the Blackpink concert, so recently we've been playing a lot of Blackpink in the OR, which is kind of hit or miss depending on who's scrubbing with me, but it has a nice beat to it, so I think overall it's good.
That's incredible. I love the next generation surgeons. Just the music.
Yes.
Amazing.
It's always a good time.
So, top 3 music albums for you.
Top 3 music albums. Well, I have to say the latest Blackpink album, that's good. The original, very first Eminem Show album, that's a great one. Very random, I know, but it brings me back to my angsty days. And then probably anything from Kygo is always popular and always something that I'm willing to listen to.
I like it. So, one song you think everybody should listen to before they die?
I don't know why this just popped up in my head, but the Mulan song, I'll Make a Man Out of You, is a car favorite for James and I, so that's what I'm gonna sing.
That's awesome. One random task you wish you could be better at?
Laundry. I'm always out of scrubs, and I'm always forgetting to return them in the machine.
Yeah, I've been there. What's the best way that you relax after a long day?
I like to lay on this couch right here, and usually we'll have a blanket, and James will bring me food, and 9 times out of 10, I'll just end up falling asleep on the couch.
Sounds like a great evening to me.
Mm-hmm.
So, are you a night in or go out in the town kind of person?
Night in.
Indoors or outdoors?
Indoors.
Beach or mountains?
Beach.
Do you consider yourself more of an introvert or an extrovert?
An introvert.
And do you think that personality trait was a factor in you choosing your specialty?
I think so. I don't really like to chat a lot when I'm operating, so I think that's a big part. And I don't really love to have long conversations with anybody, so I think it worked out.
Well, all right. Thankfully, we're near the end, so I don't know you anymore. But thank you so much for your time. We're really close to the end, but I like to always wrap these up with some reflective questions. So you ready?
Yeah.
All right. The first one, what did you think you were going to be when you grew up as a kid?
I thought that I was going to be a singer. I'm really bad at singing.
It's always a kid dream. Is there a different specialty you think you could have done?
Sometimes I think if GYN was its own individual tract and separate from obstetrics, I would have done that.
If you didn't do medicine, what do you think you'd be doing right now?
I would like to think that I would be a good travel vlogger, but in all honesty, I think that I would probably be in the wedding industry, either in photography or event planning.
That's a fantastic industry. I'll tell you that. So, all right, well, for everybody in the medical field, they know the journey is long and quite difficult. I'm sure vascular surgery adds an entire another layer on that. So were there any times you doubted you would make it as a doctor?
Yeah, there was a lot of challenging times during medical school. I don't have to tell you this, but studying for hours on end, watching your friends progress their lives while it feels like you're at a standstill, especially because I took time in between. I felt like my friends were all progressing in life, for lack of a better word, and I wasn't. So, you know, when you're kind of just studying on end, you're thinking to yourself, like, why am I doing this? There's no end in sight. I think that was very challenging.
Definitely agree there. Now, if you could change one thing about the medical field right now, what would it be?
I think that one of the big things would be how third-year medical students have their rotations. I think that it'd be great if they were able to have a lot more variety. And the reason I say that is because I stumbled on vascular surgery completely by luck. And had I not had this very specific general surgery rotation where it's the only one out of all the other rotations that do vascular, I wouldn't even be in this specialty. So I think there are some very niche things that students aren't always exposed to, and I think to be able to have that would help out a lot of people.
That is an answer I have not heard from anybody else, and I completely agree. Wow, okay. Clip that. What can a medical student do right now to prepare to go into vascular surgery?
I think vascular surgery is a very, very small field, so definitely reach out to any vascular surgery attendings that you know to kind of help you get to conferences. If there's not any type of faculty mentor, the Society for Vascular Surgery has a very, very good student mentorship program, and there's also a website called choosevascular.org that has a lot of kind of information and tips for students who are looking to go into vascular.
If you were to go back, would you change any of your experiences that got you to where you are right now?
No, I wouldn't.
Very common theme across everybody.
Yeah.
Everything happens for a reason.
Everything happens for a reason. I'm very happy with everything right now. So.
All right, and finally, question 73. What would you say to the aspiring vascular surgeon right now?
I think that vascular surgery is a very demanding field, and you have to really, really love the patient population and really love the cases to be able to do this. I think it's very tempting because it's a surgical subspecialty that can be done in 5 years, but it is very, very challenging if you don't love it. So I think if you have an inkling that you want to do this, or you're fairly certain, you know, I really recommend going on away rotations, shadowing a vascular surgeon, really talking to them about the types of cases they do, what they like and don't like about the specialty, and really, really giving yourself a really, really good exposure to it so you can kind of see the good and the bad of everything.
Beautifully said. Well, that's all I got for you, gang. Thank you so much for your time, and we'll let Paxton rest.
Of course, thank you very much. This is gonna be the thumbnail, right?